By today, most of the countries in the south and the same in the north, as we get richer, our society gets actually less healthy because we have obesity, we have non-communicable diseases, and one of the workshops today have been discussing ultra-processed food, which is so nutrition and food and what we plant, how we plant, the chemicals, all these have health impacts. And I think that's the other thing this symposium is doing, which is very important, is to bring people working in the different areas. My name is Chee Yoke Ling, you can call me Yoke Ling, and I'm the Executive Director of World Network. We are a policy research and advocacy organization. We do international work. We're based in Malaysia, we were started here, and we have a small office in Geneva because of the UN agencies there and the World Trade Organization, and we have colleagues who are in different countries in the South. We work on sustainable development, equity and justice issues, and health is a big part of our program. Well, in the work that my organization has been doing for 40 years, whether it's in health, and our focus on health is actually access to affordable treatments. We focus on actually the South and how we can work to bring our public much more aware of global issues and who influences decision making, because it all impacts us at the end locally, and to also help to use our research to help our governments to be able to negotiate better at the international level, and then to be able to have good policies and laws at the national level across development concerns, health being a very important one. So in all the years of our work, we find ourselves constantly being confronted with big business. We started as a national organization. Those of us, before we had this international World Network organization, we all started really working either through our university research or as NGOs working in the community or national level. Many of us, of course, in Malaysia. And we were fighting business at home, who were very influential in government, and then we realized as the world became more globalized and business was also reorganizing itself. So you have a whole distinct set of players, the multinational corporations, and these are the ones that actually have a lot of capital, a lot of technology advantage, and they have a lot of incentives and subsidies from their own governments in the north. So as they get bigger and bigger, because they're the first in the game, they begin to go overseas, and so we have from breast milk, Nestle promoting artificial, substitutes to mother's milk, to pesticides being dumped on us when they're banned in Europe or North America. So we were tracking all these things, and then we realized that there's a lot of, international trade, the way money is being lent to developing countries, and at the back of it, always you run into big companies. And then later on we discovered that who pays for all these kind of investments. That's when we began to learn also about not just the loans that were coming to our countries with lots of conditions from the International Monetary Fund or the World Bank projects, but also private money, the private investment money. And more in the last 20 years, a lot of the money coming in, which is very destructive to finance these big corporations, are coming from private equity funds. And then when we look at who are these private equity funds, then we realize, wait a minute, a lot of the money is coming from, money from our pension funds in the north and in the south, money that our governments are responsible for, called sovereign wealth, and they're investing in these companies. And so that got really frightening. And then we realized, well, these companies are very powerful. They never get taxed, because we're always fighting at the national level. They have to tax them more because it's how governments get revenue. But they always manage to lobby to get very little tax on them. They get incentives on land, cheaper electricity, cheaper water. So they're very heavily subsidized, and they don't get taxed. And then when they become rich, as we see in Microsoft, for example, then all the money, they don't get taxed much. They form a philanthropy called the Melinda and Bill Gates Foundation, Bill Gates and Melinda Foundation, and then they get another level from the United States of not paying tax because they're a philanthropy. And then they start coming in and putting money into health, into agriculture in Africa especially, and they influence. And after the United States, Bill Gates and his foundation is the second biggest funder in the World Health Organization. So we were then thinking, wow, so we've been doing this for so long. So we felt the moment has come. We have a bits and pieces of knowledge, information, but not enough. So when we were approached by UNU International Institute for Global Health, David McCoy, who's been also working on this issue, said let's come together because we are doing research in your university network and many universities. We do a lot of research in civil society as well. We do advocacy. The UNU can bring people together, governments, policymakers, academics, civil society, so we could work together and see how we can have stronger partnerships. And that's why we ended up here in the symposium. Well, one of the, because our focus in Global Network is actually on how do we make sure there is enough competition of different producers of medicines, especially generic medicines, in the market. Because once you have competition, prices go down. And many of the medicines that we need, the majority of the medicines we need are not very difficult to make medicines, right? But because since 1995, the intellectual property, patent, monopoly, trade secrets, copyright, trademark, because those intellectual property claims have become an international law through the World Trade Organization Agreement on Intellectual Property, it has changed our lives. Because before 1995, every country can choose whether it wants to join certain treaties on, there's a treaty on patents, there's a treaty on trademark, on copyright, so you can choose to join or not to join. And if you join, let's say, the Industrial Property Treaty, which is for patents, you can decide what products you may want to, or processes or technology you want to exclude. So you have a lot more freedom. So many countries did not give patents for pharmaceutical products. You may give a patent for the process to make a product, but I can have 3 companies with different processes, and your processes are very unique, they're very special. I may decide to give you a process patent, but the final product, I don't let you have a patent. So you have competition. So with the WTO, what we call the TRIPS agreement coming into force, all that changed. So every country within that system, which is a majority, you have to mandatorily give product and process technology patents for a minimum of 20 years. So we find ourselves in the world of monopoly. Prices went up, this has been a constant battle for many years. So depending on the law of your country, because you ultimately implement it at the national level. So if your laws are very strict about when you give a patent, what is a new or innovative product for you to give 20 years? I'll give you an example. In many countries, if I take 2 tablets and I put it together into one, and it's easier to take, because for HIV, for example, you may have to take up to 3 tablets a day. So complying with that, regimen can be very problematic. So when you put 2 or 3 into one, it's called a combination. It is easier, you just take one pill. Now, some countries give a patent for a combination. So maybe all 2 or 3 of that is already patent free, it's no longer, the molecule patent has expired, but because you combine it into one combination, you can get another 20 years. Or something that was injectable, which is very, it's much more difficult. And you turn it into a pill, it's a different form. So you can also have another 20 years. So you can have the same molecule, but because of these changes, you can have a monopoly in the market for up to 40, 50 years. So this really keeps prices very high because there's no competition. So we've been, we've seen it happen in HIV, we see it happening in cancer now. So it's very common. COVID is a classic example, right? It's not that many countries do not have capacity to make these vaccines. You can make them, but because the setup is that only a few who get the patent are out there first. And then we discovered most of the vaccines in COVID were heavily publicly funded in the US, in the UK. So the interesting story was the Oxford team in the United Kingdom had developed their mRNA vaccine over public research money. Almost like 90%, the paper has come out from the universities in the UK. Something like 90% of the funding for the Oxford team's work came from the public funding. So when this pandemic broke out, they have a patent on it, the team. So they wanted to actually say any manufacturer in the world that has the ability to manufacture this vaccine, we will give you a license. As long as you can get it registered in your country to be safe, right? And there were reports that came out. The Gates side contacted the university, the Oxford team, and persuaded them not to do that, and instead give it to AstraZeneca in an exclusive license. And the negotiation of that from the Oxford team, again, this has been reported, is that AstraZeneca will not price it very high, like Moderna, for example, the other drug in the US, the vaccine. And so they kept it so-called lower, but there was only one. So you have a shortage because they were limited in how much they can produce. So that's a classic direct case of undue influence. So now what the logic is, who knows? But it is funding that system. Microsoft really, the money of Microsoft is through monopoly. We also know it's been documented by UNDP in the early years, 2 countries in this region, including Malaysia, wanted to use all government computers to use open source. And they did move because it's so much cheaper. Again, the Gates side came in, Microsoft, they threatened to withdraw certain investments in the microchip, Intel, whatever, in the sector, if we proceeded with it. So we switched over to proprietary Microsoft software. So in medicines, you see it happening a lot. So for us, there is so much evidence, and that's why the global campaign on access to medicine has been about really redefining and even questioning the fundamentals of that kind of monopoly. So in the area of intellectual and of patents and medicines, we have the first thing to do is, even with the restrictive rules of the global agreement on intellectual property, the TRIPS agreement, we had enough negotiators who knew what was going on back in the day, and so they negotiated what we call certain flexibility. So you still have a bit more left of your national policy space, because they set international standards. To give a 20-year patent, you must show that something is new, it involves an inventive step, and it is for industrial application. So if it's purely research, you cannot look it up because other people want to research. You must show you're going to use it for an industrial application. What is new, what is an inventive step is up to each country to decide. So the standards can change. That's why some drugs are patented in country A, B, and C, and not patented in country X and Y, because your standards may be different. So the example I gave you, if I combine 2 tablets into one, and I give another 20 years, for many countries, that is not an inventive step. A pharmacy student sitting in the university can tell you maybe it's more practical to combine 2 into 1, right? So your standards, that's what makes a difference. So we have done a lot of work with many partners to try and get governments to implement the maximum flexibilities and to use things like compulsory licensing, when there's misbehavior, or go to a competition authority in your country and say they may have a patent that's legitimate, but they've used the monopoly position and priced very, very high, or sometimes don't even bring it into the market. Right? Oh, there are cases like that, So that is abuse of your monopoly position, and you can then go to a competition authority. If they investigate, they find that they are violated, automatically another company can come and manufacture or import. So we try to use that, and we also, in different countries, like in India, we work with patient groups, and many civil society groups have come together with lawyers, and they challenge the patent applications. So there are many things going on, and also, we bring up debates. That's why during COVID-19, here you have governments, South Africa and India led 65 countries in the end to put in an application in the WTO to say, let's temporarily, during this pandemic, suspend the enforcement of intellectual property, free up the opportunity for not just vaccines, but also for products. We didn't have enough masks or PPEs, right? So it really was a moment where there was an awareness that intellectual property and all these rules, they're not a holy book. If they are a barrier to health, it kills people, then we have to rethink. So we are now at the stage, and one of the things that we are going to be discussing tomorrow in this symposium is the concept of, can we do innovation in R&D in different collaborative models outside of this intellectual property box? Because this is not something that's been there forever. Before 1995, your first polio, your first insulin, they were public goods. The scientists involved never thought that it should be something that would be private property. And that's why you had polio and you had insulin out there, except that insulin then became privatized. But polio vaccine was free, otherwise we would not have a polio eradication today, right? So I think we are now saying, look at history. And this is what academics are challenged to do. How do you use your research so that you are actually able to help the advocacy work by really putting together good investigative research, document it, work and understand the reality of different countries, and that partnership is what we're hoping to get. And I'm very happy we also have a media track, because the way you report, because most mainstream media are owned also by companies. So a lot of the time it could be about pollution, about human rights, any issue, not just health. You try to report, you find editors will block you, or the business part of the newspaper will block you because you're going to affect advertisers, right? Or you could be sued for defamation. We heard some examples in this symposium of how exposing the violations of standards and laws by a company, they can threaten you by taking you to the courts. Or they can threaten governments and say, I'm going to withdraw my investment from your country. So we see that happening in so many places. And we're saying no more, enough. So we have to expose this, we have to do investigative journalism, good research, and we need to have advocacy. And that's, well, let's see where we go from the symposium. It's a very small first step, but we think it's a very important first step. Yeah, they all relate, it's all very related. I think there are many things that need to be national, but we also need to work across, because, health is not by border, but there are many issues which are very local. So you want to deliver the right kind of primary health systems. We've been talking a lot more about products, right? Mm-hmm. But really, health is about health for all. It's not about universal health coverage, which is really insurance and financing. It's about health care. This is where WHO and the Alma Ata, declaration started from. Universal health care is actually a right, which means you must have very strong primary health systems. We have to do preventive. Right, today, most of the countries in the south, and it's the same in the north, as we get richer, our society gets actually less healthy, because we have obesity, we have non-communicable diseases, and one of the workshops today have been discussing ultra-processed food, which is so nutrition and food and what we plant, how we plant, the chemicals, all these have health impacts. And I think that's the other thing this symposium is doing, which is very important, is to bring people working in the different areas, right? Whether it's hardcore financialization and trade and intellectual property, or health or agriculture or climate change, they're all interrelated, because health is social, commercial determinants. All these things are coming out, but very rich, very inspiring. What do we do with all that information and analysis? And I think that's a real challenge. I come from academia originally. I went full-time into civil society organizing, but really at the policy level. But always the way to keep ourselves clear and accountable is that everything we do has to be tested against our own reality in our own countries, and as we learn about other countries. So I think that kind of partnership is also very important. And I'm eternally optimistic, because otherwise we give up on things. No matter how bad things are, the other side wants to use the UN. The other side wants to change the laws to legitimize what they do. So we can never give up that space, no matter how hard. So we know there are always people in government, in the UN agencies and secretariats who really want to do things. So we got to find those allies. And not everybody in the government, not every parliamentarian, not every politician, is bad or corrupt. So we got to find the like-minded people. But at the same time, remain very independent and be able to call out when we have to